healthcare legend. Mr. Tulsi Raj is a founder of Lions Arvind Institute Community Ophthalmology, LICO, as we all refer to, and a benchmark in eye care across India and beyond India. We have studied case studies about that as well. So, sir, welcome to the panel. Uh, we have Mr. Neeraj Lal. Neeraj is a very dynamic professional as a vice president and cluster head of Rainbow Hospitals across South and Karnataka. And his dynamism reflects in the way he has grown the group from where he started with them and how they have followed up with multiple more centers. And it's also a pleasure to introduce him here on the panel as he's also my alumnus colleague from Tata Institute of Social Sciences. It's a pleasure to have Neeraj on board.
Hello.
We have Mr. D.S. Chakravarti. D.S., as I know him, is again a leading personality in terms of how he has transformed a tertiary care facility down south. He's the CEO of Prashant Hospital, very focused tertiary care facility for urology and other key multi-speciality facilities services. And he's a great personality and a person to work with, and a person who comes with a very strong technology background. So pleasure to have you on board, DS, for this session. We have Vivek Srivastav. Vivek is the founder and CEO of Healthcare for at Home, and again someone who has created a niche for himself in this sector, and we'll get to hear more from him as how dynamically he has built the organization and been able to build services around the care, especially in today's time when home healthcare is something which is kind of pivotal in the current scenario.
Thank you,
Vipin. Welcome on board, Vivek. And we have Vipin Pathak, an alumni from IIT Kanpur. Again, someone who has had the courage to get into the entrepreneurial world and create as a CEO and founder of Care24. He has been able to create a group of professionals, trained professionals in healthcare, paramedic and clinical, to be able to and servicing the home healthcare sector in India. So again, a pleasure to have you, Vipin. It's always nice to have you on my panel. Thank you for joining in.
Yeah.
So
thanks, Vikram. Hello all.
So welcome to all of you. I'm so happy to have this panel with me to discuss this area and to deliberate on the subject. Now, to just start with, I will just give the framework of the session, which we will carry for even the attendees of the session. I will give a quick context to the discussion for today, the panel discussion for today, followed by a kind of an opening remark from all of the panelists, all of you, and then we will get down to some specific questions which we would like to cover, and I would love to pick on your minds to reflect upon some of these key areas and get these insights. So, I mean, just giving a concept and a context, as in facts about where we are today with the pandemic. The pandemic has certainly led to the consumer behavior changing in terms of how he wants to seek healthcare. And with this behavior change of how he wants to seek healthcare, we see, and that he has changed his behavior, and it is further changing. And what we see is that with this change of seeking healthcare, the healthcare delivery system will have to come around this customer and also provide services accordingly. The other, and what we've, with this change happening, what we've seen is, observed is that digital health has come around well to support this need in for the delivery system. And if I was to further expand on how digital healthcare is looking to support the complete healthcare ecosystem, is how the care will get delivered, is that the business, as per the recent study which is being done, is states that digital healthcare and telemedicine itself is going to account for a market size of about 5.5 billion dollars. So that's the kind of capacity which this kind of the digital healthcare is likely to take as one of the emerging trends, and from technology perspective in the healthcare ecosystem. And where this 5.5 billion is coming from, US dollars is coming from, is where they are seeing a shift of approximately 15 to 20% of the healthcare business shift will move towards digital healthcare, and 95% of this business size is going to come from telehealth, home healthcare, and other digital formats and technology services, is what it's kind of anticipated in terms of one of the recent studies which has been carried out by Ernst & Young. India, in the light of all of this happening and this change happening and how the healthcare delivery system is coping with it, we also see the National Digital Health Mission getting launched by Government of India. And that's a very interesting development which the government has also realized and has coped up with the changing environment. Not that it was not already there on the plans, it was there on the plan, but it's kind of got fast forwarded to support the ecosystem. So given this background, we would like to discuss the various dimensions of this change in delivery of care. And the whole idea of this panel discussion is to not only understand these dimensions of technology and which is coming about to service healthcare delivery better, but also as to how to make it more effective from a healthcare ecosystem's perspective. And so with that, I'll open the discussion, and I would, and in the core of this whole discussion dialogue, let's keep the focus on the patient, who is the most important person whom we are all coming around to service. So with that, I would open the discussion, and maybe we'll start with opening remarks from all the panelists. And I would like to request, Sir, Mr. Tulsiraj, maybe if you could start with your opening remarks, and then we could go to Vivek and Neeraj and DS and Vipin there in the similar format. So over to you.
Thank you, Vikram. Unfortunately, probably due to my end, couldn't hear you very clearly, but got the gist of your opening remarks. So I'll just make a few comments. I think the current, at one level, the digital technologies invading, becoming mainstream into healthcare has already been happening. Now, from the periphery of being a support service of hospital management system or supply chain and so on, it has been making steady inroads into core patient care activities. And what this COVID has done is it has sort of accelerated that process. I would say at both ends. At one level, the public or the general community is getting a lot more digitally savvy. They're forced to, from digital payments to remote classes. Like every home in the middle class, at least, there's a child who is engaging through distance learning. So that whole ecosystem is evolving to become both digitally savvy and then also be acceptable of some remote services. So I think that's happening. On the other hand, I think on the tech side also, things are evolving at a much more rapid pace. This I fundamentally would say is what this COVID has brought about. So at our level, we are basically we provide eye care at a fairly large scale, and we have been leveraging technology quite a bit for almost last 4 decades, since 1983 onwards. Some of the more recent developments, which are very, very exciting, I would say, is around democratizing healthcare, sort of bridging the competency gap. No, because in the current era, still in the current era, if you really want to get good healthcare, you got to be in one of the bigger cities. No, and you got to go to the most competent physician or a medical professional, and only a few can do it. Now, which means the quality healthcare is kind of very lopsided and not inclusive. But the technology, we are kind of starting to see how this can break that. Now, like for instance, we had teamed up with Google along with a few other hospitals uh, to uh, to kind of diagnose diabetic retinopathy in early stages. This is something in the realm of retina specialist. But now in our primary eye care centers, now we have 100 of them in small rural villages, where a technician is able to take an image and upload it, and within about 15-20 seconds, it gives a response, reading the image, and also a broad direction, not treatment, but triaging, saying that this patient is normal, or they should go to a doctor, or if it's very urgent, and so on. So this is something which would not have been possible without digital technologies. So I see that as an important aspect, and this is happening in multiple areas: retinopathy of prematurity, glaucoma. Because in our field, a lot of the diagnosis is image-based, visual. Normally, when I say image, the doctor is looking into the eye to figure out what's going on, which means we can take an image and have technology sort of do that work. The second aspect that I'm seeing on an operational basis is technology is helping us to enhance quality and safety. There's a lot of stuff which you just cannot monitor or manage when you have paper records. But with electronic medical record and related technologies, we can enforce a lot of best practice protocols and almost eliminate errors, that can compromise patient safety. And just one more point before I stop. Again, when it comes to compliance, quite often medical professionals will diagnose and we prescribe, or we refer them to some center, and very seldom are we able to manage the compliance. Today, we're able to track them much more robustly, and then make sure, because unless you help the patient to comply with your treatment advice, the patient doesn't get better. So up to that point of time, all the efforts are essentially wasted, whether it's diagnosis or the travel or whatever effort the patient puts in. So I think this to me is not a sexy kind of digital this thing, but I think this is what makes all the difference, because between advice to compliance, in certain conditions, the dropout is almost 50%. And in all chronic conditions where it is slow onset, the lack of compliance is in the order of 70-80%. So I think helping in that area is again a major contribution that the digital health is making. So I'll stop now.
Sure. Thank you, sir. I think those insights were very helpful. And over to you, Vivek.
Thank you, Vikram. So I think on the overall emerging trends and technology, currently specific to what has happened and what's happening in the COVID environment, I think one of the things which we are seeing very rapidly happening is people wanting to go to get treatment in their home, right? In their home, possibly in their community, but not go out inside a corporate hospital or a tertiary care facility and so on, because they are scared, right? Which essentially means that all the things which earlier were oh ye ghar pe kaise karenge has moved to kya ghar pe kar sakte hain, right? So that's the change which has happened in the people's mind. Whoever is thinking of healthcare now, he's thinking or she's thinking that can this be done at home? If it can, let's do it there. If it cannot be done, that's when we'll go to the hospital. Earlier it was not the case, right? Which has also led to a trend where uh, many places where doctors themselves were not so supportive, and I'll not say supportive, but they were not trying. This has actually forced them in the trial, right? And hence we have seen 10x growth in the digital consults. A lot of action is happening in monitoring of patients and so on, in treating patients at home or in the community, which is also being fueled by whatever uh, the telehealth kind of technologies which are available, which were there earlier as well, but the adoption has increased dramatically. The device ecosystem, like Mr. Tulsiraj talked about, the devices which take photograph and so on. Now similar things could actually be explored to be done at home, and hence manage a lot of diseases in the home itself. So those are few trends, and I'm sure I don't want to spend a lot of time. Other people will also have to add, but clearly what we are seeing, and just so that people know who we are, we basically manage disease of patients in the home and in the community, and we touch about 1 lakh patients a month, right? And in these days those numbers have increased dramatically because of we handling a lot of COVID patients at home, which we'll probably talk about as we go forward. And we work with on one side people like the pharma companies, the doctors directly, the hospitals, the insurance companies, and now the government and corporates as well, and payers on the other side paying for these services. So that's where we are. We handle complicated things like ICU at home, to managing chronic diseases at home, which are early onset and so on, which are not as critical today, but if they are not managed, they become critical later on. So that's who we are. I'll stop here.
Neeraj, please.
Yeah. Hi. I'll just take you to the mother and child segment. We run Rainbow Children Hospital under the brand Birthright by Rainbow, which is for mothers, and Rainbow Children Hospital for children's. So I represent Bangalore and Karnataka region for Rainbow Children Hospitals. So I'll just tell you what are the challenges we face, and maybe in the second time I'll tell what we have done. See, people are not coming out for consultations. They are creating panic among parents when the child is sick. We are getting so many calls from the call centers. People are not coming for consultation. As a result, vaccination you can hold on for a long time, because we did around 200 vaccination daily. Those people are not coming. Parents are calling. Children and mothers getting COVID positive. We can manage children, but for mothers, we don't have beds. We are not meant for mothers to deal the COVID positive cases. Accumulation of patient, the OPD, we got a huge area, but still whenever a child is coming to the hospital, it is coming by your mother, father, their family and friends and all those things. And revenue at the same time, since we are the PNL heads, we have to maintain that revenue also. Structural and processes changes we need to do. And shortage of masks and sanitizer in the market. I'm talking about somewhere in April and May, at that time. And we also do a fetal scan, like we do around 200 delivery per month in both the Bangalore centers. So fetal scan cannot be avoided. Delivery cannot be avoided. So we are passing through that stage. And what we feel, all the challenges bring some good opportunities. So maybe in the second part, I'll talk about what we did and what are the technology interfaces we did so that our business, became normal. We were around 45% in the month of May, and now we are doing almost 100%, and still the COVID is in the air. So I think in the second part I'll talk about more those things. It's for me. Thank you.
Thank you.
Good evening, everybody. Yeah, good evening, everybody. Almost my seniors have covered the required part, what they experienced in metros and other cities. Now I'll be more specific into my B class city perspective, where almost all B class city hospitals and doctors are almost, I can tell you, we are very reluctant in adapting the technology earlier. But now COVID has forced us to adapt the technology, taste the technology, show the same technology and the trends to the patients who are here. Till now, the market was only my doctor and my hospital. Now it is not that. It is our doctor and our hospital. People are looking at easier ways to approach the doctors, get their treatment done, get their interventions done, analyze, take different opinions. Even they are also getting. Of course, we are having some hurdles like cost, patient adaptability, diverse the locations, because our country is so much diversified with populations. So many government schemes involved where we are unable to implement the technology at our will and wish. And of course, there are so many parallel advantages also to the patients as well as to the hospitals. We are able to maintain good records as advantage. We are able to service the patient as an advantage. And even the patients are having an advantage. They don't need to travel by spending thousands of rupees, which they used to do earlier. And today it was a metro concept and a non-metro concept. Today, even the metro people are approaching a non-metro doctor if the doctor is really identified in a proper way. And even the non-metro people are able to easily take an opinion to the metro and get the treatments done. So this COVID, which and the new normal of the COVID has really opened eyes to all the public, government officials, and even to the healthcare facilities, where even the government is seeing us and supporting us in such activities which they were reluctant to do earlier. So hope this new normal we should take an as advantage and as a benefit and as an opportunity to expand our services, to liaison with each other, do some joint programs with the government in a PPP mode, in individual mode, or in a innovative mode, because technology is in our hands and the approachability is very easy for us. This is where I like to conclude as a point now, and I'll continue when you start asking your panel points.
Sure. Thanks, Vipin. Vipin, over to you.
Hey, so I think
Please
most
go
of the points have been already covered. Yeah. So I would say that I remember a dialogue from a movie says कि कुछ घटनाएं सोचने के तरीके को बदल देती हैं. So I think it is one of that times when, say, because of whatever reason, this pandemic has started forcing all of us to think and actually implement some of the things that we have been thinking for 5 years. Like most of the everyone from the healthcare ecosystem, if you say whether it is insurance, whether it is pharma, whether it is hospital, whether it is home healthcare, we all have been thinking about some ideas for 5 years, but now it has the situation has kind of forced us to implement that with the kind of urgency that it was always needed. And if you see the whole government scheme, then I think there's a nice system that people are talking about, like national healthcare mission and national healthcare system. I think that this is a good. I mean, in one way that since there is a pandemic, there is hardly anything good about it. But I would say that let this crisis not go for a waste. Let's use this opportunity to make sure that the tomorrow on health, especially from India perspective, is far better. We have been lacking on health massively. I would say we are one of the worst in the overall healthcare system across the globe. So it is trying for us to kind of rise and shine and make sure that everything. I'm like a national digital healthcare mission. I would say that's one of the best initiative that could have been taken, and I would like to say here that we all should sort of participate and make sure that that is a huge success. That's probably from my side.
Okay, thank you, Vipin, and thank you for your opening remarks, all of you. Mr. Tulsi, I'll like to come to you, sir, to my next question. Sir, can you hear me? Mr. Tulsi? Hello, am I audible? Hello?
Yes.
Mr. Yeah. Okay.
He cannot able to hear, I think.
Acha. Mr. Tulsi, this question was to you.
I can hear. I could hear slightly broken, but I can hear.
Okay, Mr. Tulsi, this question was to you. Looking at the new normal and the environment which we have, I mean, the ecosystem, the change which it is going through. You, unlike others, as you rightly said, that you have been digitally savvy long back. I mean, it is not new to you with working with technology. And being a visionary, you had been interacting with various bringing in technology systems, like you mentioned about the Google and the automation with AI for diabetic retinopathy, which you have launched. A couple of things we want to ask from you as to, because the other critical thing is that you are, unlike others who are into metro, you are looking at a tier 2, tier 3 community programs as well, and reaching out to the people who are otherwise not reached normally. And with this COVID environment, so 2 or 3 questions I may want to break it towards for you. First, give us a little more experience on how this automation in terms of AI you brought in earlier, you had thought through it, and how that has helped in improved productivity, improved connect and access to services, and obviously affordability. The second part of that question is, how have you seen the response from the community which is otherwise not reached out to and how have they kind of coped up with the technology which you are using, and are they as accessible, infrastructure is good enough to be able to service them in those regions? And third, the technical team, because I believe that while the digital technology transformation is happening, are the health workers, doctors themselves trained enough to be able to provide that seamless support and care? And that's where the investment in people in terms of training them alongside is important, which again, I am aware you have been doing it over years to kind of make them competent enough across all levels of healthcare service members to deliver these services. But I would really want to learn a little, we would like to learn a little more about some of these 3 areas. The automation, how that has led to productivity, improved productivity to all stakeholders. The community reach and how community has responded to technology and whether infrastructure is good enough. And third, the training and capacity building of the paramedic and doctor staff as itself to manage technology. So, Mr. Tulsi, we can't hear you.
No, I'm not talking yet.
Okay.
I couldn't fully hear Vikram. If someone heard him fully, can they paraphrase what the questions were? I hope I am audible.
Yeah, you are audible, sir. Can you hear me now? Am I audible? Am I audible, sir, now?
So Dilip, if you heard everything, can you? Yeah, yes, Chakravarti, we can hear you. I can hear you quite well.
Sir, this is Vikram here. Can you hear me now? What?
Yeah.
So what I wanted to ask was that you introduced technology and AI initiatives much before and had in a more planned manner and much before this pandemic happened. What has been the impact of that on productivity, on access and affordability to the community? The second part of the question was that how the outreach has happened with the limited infrastructure or whatever infrastructure in the country we have for carrying out these functions, especially on from a digital perspective, and how has the community responded to that in taking up such technology services? And third,
the capacity building of the paramedic and healthcare staff itself to be able to provide such services seamlessly.
Okay. Yeah. So in fact, Vivek helpfully has typed these questions. So how has community responded to the technology or technology change? In my mind, they are not the problem at all. I mean, I think they are very much at home. Even rural people, even this we have seen, because we started telemedicine in 2004. When broadband was barely there, so we had put up our own broadband network to be able to do that. And then even today we have 2,000 to 3,000 consultations happening, but they're all what I would call as a B2B format. That is, they come to one of our centers, and then the center is equipped to do all this stuff, and then the back end we are equipped to respond to them, and it all happens in real time. So from the patient point of view, I think there is no real issue if you can enable them to happen. But I think the challenge that we will have now is a B2C model, wherein because in the current setting, everything is under control in terms of technology and facilitating and everything. But if a patient directly wants to contact a healthcare provider, I think we still have a long way to go to make it into a much more robust kind of a process. Of course, they can telephone and ask, and all of that is remote care. But then where it is much more well documented, you have medical records, and so that kind of a format is emerging, to my knowledge. And I think this will get accelerated as the hospitals embrace electronic medical record at that end. So then I think it can work a little more seamlessly, because one of the fundamental rules has got to be good documentation of all encounters, whether it is remote, digital, or in person. So that really is the challenge. And in terms of impact on productivity and community reach, I think technology is playing a huge role, at least in our own experience, because this whole notion of universal coverage or universal health has been a kind of a holy grail, which is yet to be achieved. Health for all came and went. So many of those aspirations came and went. But then when we deployed these primary eye care centers with technology enablement, with real-time telemedicine, we are able to actually document and show that everyone in need of eye care has actually received it in those communities. I mean, roughly about 7-8 million population. And we have the evidence to demonstrate that. So which I don't think will be possible by tertiary care, secondary care centers, which are much more reactive. They deal with patients who come. So I think technology is going to be a huge enabler of inclusive health, from a community perspective. And this also, I think, directly, indirectly, plays a huge role in the capacity building of the paramedics. Because in our primary eye care centers, we have only paramedics who are running it. They deal with 40-50 patients every day. And because every patient get a live teleconsultation based on the investigations done by the paramedic, they get an immediate feedback as to what that translates to. So almost unknowingly, these paramedics' capacity increases with every patient that they see and present to the ophthalmologist and hear the feedback. So that cohort of people, in my mind, are pretty almost at par, with a well-trained ophthalmologist from a diagnostic perspective, not from a intervention perspective. That apart, I think other more standard platforms like digital learning, enabling teachers with good content for improving all of that is also there as additional venues. So I think how we harness this technology is largely left to our own our own imagination, I would say. I think today a lot of the limitations have gone. I think the demand is there, the desire is there. So it is really up to the providers' imagination to take it to the next level.
Yep. Thank you, sir. That was very insightful, and that's where we were very keen to hear your views.
Over to you, Vikram.
Thank you, sir. Thank you, sir. Very informative and very insightful, sir. Because 80% of population needs to be covered adequately, and that's where technology needs to be effective to be able to for them to be able to access care as well. So this was very informative. Thank you very much. Neeraj, I move to you. Being responsible for mother and child care.
Yeah.
Again, and I am my heart lies with public health somewhere. So I correlate the public health systems to a great point, and see how the learning from the private sector can at times be transferred as a template for used by the government public health system as well. So, and mother and child is one of the key areas which not only from a private sector, from a MCH perspective, reproductive health and maternal child health is one of the largest programs which Government of India is driving through the NUHM and NRHM programs. So we'd really love to hear as to how, because this was a very sensitive group you were handling. The child is very sensitive to be open to a COVID environment. Mother also passing through this journey has to be taking good care of herself. How have you been able to engage with the patients and with mothers to be able to and manage this period? And as you were saying, vaccination and other services become critical to this journey. So we'd love to hear what about the initiatives you've taken, and how do you look at sustaining the engagement with your patients, mothers in this case, and keeping them well aware and informed.
Yeah. Yeah. So what we did, we were missing on a vaccination. You know, as I told you, we do around 100 to 200 vaccination per day. So what we have done in order to reach our patients, and there was a panic call by the parents. Okay, how can we mix the vaccination? We cannot postpone for a month and so. So what we did, we have created a small videos of our doctors, and we have sent those videos to the patient database awaiting vaccination. And we told the environment at the hospital is not safe. Just don't worry about the vaccination. Whenever there is time, we'll be in touch with you and the vaccination will be given. Then we have started a home healthcare concept in which a team of paramedic, a doctor, and a customer care we have done a tie-up with around 25 apartments in and around Bangalore within a 10-kilometer range. So our vehicle is going to the apartments where our doctors and staff nurse, by wearing a PP kits, they used to do this vaccination on a scheduled appointment basis in the clubhouse of the various apartments. And people have supported this initiative in a big way, because most of the hospitals are closed, small doctor clinics and private clinics are closed. So we were doing around 50 to 60 vaccination per apartments. So as a result, in these 2-3 months, we have done around close to 4,000 vaccination. Home health vaccination drive we have done in the apartment. And from the business point of view, around 200 apartment we have covered in this last 2-3 months. And now video consultation, if you see in the month of April, we were doing around 8%. Every day we see around 400 patients in the hospital. So in the month of April, around 8% video consultation was there. So what we have done, we have created TV ads, we have done a community webinar, We have tied up with a corporator and local MLA. So he had called a community webinar, SMS blasts and paper inserts we have done. And so we have done around 26% of the total patients is coming on a video platform. And we have started a e-prescription. So whenever a video consultation is booked, there is a e-platform which our doctor goes. The consultation is done on a video consultation and an e-prescription is sent to them. So whenever we are doing for a vaccination at their home, we are also taking pharmacy medication to their homes. We have also started a culture of a hand washing anthem. There is a fourth time a staff nurse, our infection control nurse, there is one alarm in the hospital where we used to request every patient, every paramedic and doctor in the hospital, please stand. It's a time for, it's a code white, please stand and wash your hands. So that is a continuous thing 4 times in a day we used to do, because our staff is exposed, our doctors is exposed. And some of the deliveries, like we were doing around 100 deliveries at our Marthali branch and around close to 100 delivery in Banargata. So most of the hospitals are not taking these patients because small clinics and the small maternity centers are closed. So we have created our one of the floor as a COVID floor. We are doing the COVID deliveries because most of the doctors are not taking those deliveries. So we have created 2 doctor teams, odd and even. Like some doctors are working Mondays, Wednesdays, and Saturday, and second team is working on other days. So they used to do COVID deliveries. As a result, our deliveries also goes up, and a rapport has been created. And we are taking that particular pediatrician and a gynecologist on a video consultation, so that they should not have a feeling that we are pouching on their patient. And as a result, now our deliveries has also gone up, and a rapport between the pediatrician, visiting pediatrician, as well as the gynecologists have gone up in the big way. Like entry of the hospital, we have to do certain structural changes to create a fever clinic outside. So we have to engage a security guard or a staff nurse in the main gate. So since Bangalore is a startup hub, so there is one company who has given us a social robots. So these robots used to place at the main gate of the hospital. They ask the patient whenever they entry to the hospital to wash your hands. There a sanitizer bottle has been given, and they are used to transfer the sample from one ward to another ward. So around 2-3 robots in the form of a chota beam and all. So they are going around the hospital and doing this job. So a culture of motivation and awareness is there across. So these are the few things which we have done in our hospital. As a result, around 80 to 85% of the business is back now. And a feel-good factor is there. And community vaccination drive, I'm sure the people who are not coming to our hospital, they're so thankful to us. Okay, we have gone to their home in the clubhouses and given vaccination. So these are the few things which we have done in the last 2-3 months.
Thank you. Thank you, Neeraj. That was very informative. And we certainly look at public-private partnerships from a maternal child health perspective coming up with the government, working with the organizations like yours. Vivek, I'll now move to you because we've spoken about, most of you have spoken about the people's perception and the concern they have of not wanting to move out, go to a hospital and get exposure to the hospital in a COVID scenario. And so home health care, home health management, disease management, and remote monitoring, that these things have now kind of become something very regular, and kind of the delivery of services kind of changed, come around home healthcare, so to say. And people have coped up well. We just heard Mr. Tulsi say that even the community is kind of being able to receptive to such services. But more from a stakeholder perspective, because there is the pharma, there is the payer, and the government itself is a huge body. How have they been, and healthcare providers themselves, how have they been reaching out to patients? Because I think patient engagement and helping patients manage disease from their comfort of homes is becoming the new normal. And so your role becomes even more critical. So can you kind of just reflect upon how this change has come about, and what were the demand which came about from the various stakeholders, and how do you service the clients and empower them I should say, the patients in managing their disease from their comforts of home?
Sure. So, so I'll just divide this into two parts, right? One is treatment of, detection treatment of COVID, and then there are these other diseases which we need to handle.
Yeah.
So in terms of the COVID side of the, in terms of COVID side, um, Neeraj just talked about a lot of things which are happening because of hospitals also moving in the home direction and so on. So from a COVID perspective, we did a lot of sample pickups just for the diagnostic side at home. Thousands of samples on a monthly basis were picked up by us because patients didn't want to, or potential patients didn't want to step out. That's one thing which we did. The second thing which we did is that we launched India's first home isolation program, and that we are doing with three set of stakeholders. One, we started with doing, by ourselves, we in any case did, but then we reached out to Fortis, so all Fortis hospitals working with us on home isolation program. The second set is the insurance companies. So ICICI Lombard, HDFC, Ergo are working with us, and few others who don't have cashless. These guys have cashless around COVID home isolation, right? And as you know, that 85% of the patients who have COVID can be managed at home. So it's a large chunk. If these people move to the hospitals, God save the country, because the infrastructure, in any case, with the 15% is crumbling. If 85% come to that, then it becomes a very, very big challenge. So insurances actually have agreed to pay for COVID related services, and IRDA also came up with guidelines that COVID needs to get covered. The third stakeholder in the COVID side is the government. So in the government, we have been working with the government to manage home isolation of patients who are being diagnosed, and there are certain criterias under which you can be in home isolation. Effectively, that turns out to broadly 50% of all the patients who get diagnosed COVID can come into home isolation. So we are working with the Delhi government, we are working with the Karnataka government, and we recently won the tender for the Punjab government. And we would have handled about 1 lakh patients till now, and about 75% recovery rate, less than 0.1% of mortality, only 5% hospitalization. So this has been a very effective method of managing care at home by and this is a large portion of it is coming from government. There is private, there is insurance, there is hospital, but the volumes come when government comes into play. And last but not the least in this is the corporate. What has happened is that a lot of people got uh, the employee motivation. The employee had a lot of challenges, because earlier any person, if he has some problem, goes to the nearest clinic, nearest hospital, manages himself. Now that gets broken down, and once that gets broken down, they get confused, they get paranoid, which leads to employee absenteeism or loss of productivity. And that's where we partnered with corporates as well, to manage helplines, to actually run some of the coming back to the factory programs as well, where we actually did screening. Like Neeraj said, we also set up fever clinic, or an isolation center outside the factory, and did for very large corporates, the Tatas and the Aditya Birlas and so on and so forth. So this is on the COVID side. On the non-COVID side, we work with a lot of pharma companies, as I mentioned to you, right? And there we have been managing about 40 different programs with almost all top pharma companies you can think of around chronic diseases. The sad story is that because of COVID, the chronic patients have stopped coming to the hospital, which will lead to an escalation in their a deterioration in their condition as we move forward, right? So we have intervened there, tried to get people to connect to the doctors technologically, manage them remotely, manage them at their home, so that they don't deteriorate. Because that will increase effectively the load on the hospital. Maybe not now, they're not going there, but if you deteriorate, then you'll have to go into the emergency, which will increase the overall cost. Of course, we also worked a little bit on the COVID side here, because we manage some of these, manage the DRL call center for Avigan and other products which are especially COVID related products, and delivered a lot of products to the patients. Because of the lockdowns, many things were closed down, but we were able to reach out to the patients and deliver products as well, and deliver a lot of service to the patients when no one else was able to deliver. We didn't drop a single patient because of lockdown.
Sure. Thanks, Vivek. I think home healthcare has become very critical from that perspective of access to patients. DS, we have covered aspects of primary and secondary care, and chronic and maybe wellness to some extent services. But acute care is something for which one needs to see how it is getting managed by hospitals and providers like yourself, who are dealing with tertiary care. How have you been able to create a balance for providing acute services at the hospital, and if there again some technology intervention has been used for management cases, and also post management of acute case or triaging a case? How has the home care been supported, or teleconsultation been supported?
Yeah, thank you, Vikramji. Since we are out of time also, I'll just rush with the points. So we simply concentrated the COVID period as from war time to peace time. And now we enabled, we didn't till now enable our technological advancements. We enabled the technology advancements, and we did an operational excellence changeover in our organizations, specific to the location, geographical location, to the patient population, and we went as per the patient psychological requirements, like more of elective surgeries, more of like a online offline integration platforms. We separated the ancillary services from the regular services. We concentrated more on ambulatory and daycare procedures, and we did the turnaround faster in such a way that we utilize the technological advancement in maintaining the medical records, integration of information to telehealth, and we tried to utilize the available digital tools virtually. And of course, we went more into flexible reimbursement models, and we also made the customers adapt to the change. That's where it was very important. The customers also and the consumers also adapting the change. And of course, we are having our limitation is in accepting the regulatory changes. So we are limited with the regulatory changes, and of course, the new change order in operational excellence, the revenue and the cost has to be managed, and of course, everything has to be consolidated practically as per the location and the organization structure. That's what we did, and we more utilized on the telehealth and a telemedicine platform, which was zero in our location. Even today, we are finding a problem of patient adapting that, and of course, we are late in adapting that. We should have much adapted it earlier before the COVID only, and educate the patient and the disasters principles in process. Yeah, since time is less, I'm taking my discussion. Yeah.
Thank you, DS. I think you've able to create a great balance between managing acute care of triaging the patient, as well as kind of through teleconsultation actively supporting the patients from home. And the capacity building is something which you've again highlighted, and that's what I'm happy to hear, that staff needs to be trained up across. Vipin, you have a very well-trained team, clinical and paramedic team, to support home healthcare again. And how have you seen they coping up with the patient's requirement? Have digital tools being adopted well by patients, being monitored at home for providing clinical care? And the second area is that beyond COVID, there is wellness and chronic diseases. Vivek touched upon that. How do you see that the patient can be empowered at home through a digital mode, through a patient engagement structure and a more hyper personalized patient engagement format where you empower him, educate him to be able to manage some of the disease concerns, primarily from a wellness perspective and also chronic disease perspective. Please, if you could share your thoughts on it.
So, yeah,
We have
I
another
guess
2 minutes.
we are already overshooting the time. So
Please carry on. Please carry on.
so yeah, yeah. So I would say that from what we have seen is clearly from a consumer perspective and from, say, especially the patient's perspective, the ability and the intent of consuming a lot of content, especially around health, has gone up massively, right? So through, say, remote consultation, through teleconsult, through telemonitoring, everywhere, right, people would want to kind of consume a lot of content. People want to be sort of be in control of their own health. And through our own call center, I think Vivek has already touched upon that aspect, that we have been able to kind of guide a lot of people already in this COVID times. Their ask is continuously higher and higher, especially on the chronic side. If somebody has a comorbid situation, and because of the COVID, and in general, I think apart from COVID also it applies. And so we are currently in talk with some of the people outside who have developed nice content around that, especially around the chronic care management. And we believe that this would go a long way, both, I would say, in terms of we have to figure out the right delivery mechanism, because the language kind of context, the kind of background that is applicable in India might be a little different from outside. But I am very, very bullish that this is going to kind of go very, very long way. And if we get a little support from the government and overall health ecosystem, I would say that this is going to be a really a game changer in health. That's my sense.
Okay. Thank you, Vipin. I think that was very helpful. So I'll probably like to close. We've run out of time here today, but thank you all for your insights. And I think the takeaways of how the community can be reached out, and the apprehension that the community is not ready for this is something which Mr. Tulsi has opened up the concerns. Opened up the fear that it is not so. Community is receptive. So, and that is where some of the learnings from this insights we have got is something I believe that it has to be transported across to working with the government systems also. And this whole scheme of COVID management, I think what is also critical in providing healthcare is that while technology is going to play its part and it is going to help improve health, but the care part of the patient needs to be always kept in mind, because they are the ones who are going through a lot of anxiety and issue concerns on how to manage services and manage their disease at this point of time. And that is where, if as a caregiver, we can come around him and say that you will be all right. I think that's very important for all of us as healthcare providers in some part or others, to be able to support them, empower the patients in terms of being able to manage their disease better through a personalized care. Regulations have to improve, and as Mr. Tulsi said, that the government has come a long way. We have infrastructure has improved, and some of the laws from telemedicine and other functional areas through the health mission, digital health mission program, should improve further from what guidelines have earlier been given. And above all, I think some form of a positive ecosystem for supporting digital health and training the healthcare workers becomes very critical to make this experience seamless. So with that, thank you everyone for being a part of this panel.
Thanks a lot.
I really appreciate and the insights which you have brought in, and I will consolidate some of these information, insights, and present it to the committee of Voice of Healthcare and the group. Thank you so much.
Thank you.
Thanks. Thanks.